So I'd like to ask if this risk is considered too high for the manufacturers economically. Surely we cannot allow our children to take the same level of risk with their long-term health, especially for a disease which is a so negligible risk to them. And as Claire pointed out earlier, medical history is littered with drugs and vaccines that were once considered safe and effective, but were subsequently withdrawn from the market months or even years after their use was started, as unforeseen harms were identified. And Claire talked about the pandemic vaccine that was rushed to market in the 2009 pandemic, withdrawn a few years later, but only after millions of doses had been given, and over 1,000 children suffered the serious brain injury, narcolepsy, which had not been picked up in the trials. We really need to go back to the safe practice of medicine, which involves adapting and adjusting to new data and safety signals. And at this point, I think it's unprecedented that a pharmaceutical product that's still in the clinical trial phase is being recommended and administered to children on such a mass scale. And that this is being done without full transparency and disclosure of the known and, more importantly, unknown risks to children and young people, and with the aggressive marketing, actually seriously undermines the ability of parents and teenagers to give full, voluntary and informed consent. That is a legal and ethical requirement for all medical treatments under UK and international law and professional guidelines. So we've got to the point, I think it's vital that we go back to the ethical principles that underpin any civilised society, and that we put the safety of our children as our top priority. There is no scientific or ethical justification to support any further rollout of COVID vaccines to children. Therefore, we must urgently pause the programme. Thank you.
Well, we've all been in the position of talking rather in theory about various potential hazards from the vaccines. But one of the things that's been concerning to me is the downplaying and, if not verging on censorship, of anybody who actually has suffered from harms. We are very grateful to have Max come today, because we didn't invite a child. We thought it was not appropriate at a setting like this. And we've got Max here, who's going to talk a little bit about his own experience. And he's here not just for himself, but for the hundreds of people that we already know and the thousands who we don't know about. So Max, do you want to just start by just giving us a little account of what actually happened to you after you had the vaccine?
No, for sure, and thank you very much for asking to be here today. Good afternoon, everyone. My name is Maxwell Harrison. I'm currently an aspiring barrister at BPP University. Alongside of that, I've been a ballroom dancer. So the stuff you see on Strictly for the last 14.5 years. As a mild disclaimer, I have no credentials or background about medicine and whatnot, so I do apologise in advance of that. But no, so for my own personal experiences, in September I received my second Pfizer vaccination, and that was on the 1st of September, I'm trying to remember it myself now. And from then, after 8 days, with my good friend who sat with me today, I was taken to a hospital just around the corner from here after suffering a cardiac episode whereby I couldn't breathe. And from there, every day gradually, from that hospitalisation, I experienced severe palpitations from my heart. These usually came about when I had to do physical exertion, so it increased sort of heart rate, and they thought it was anxiety attacks. And anytime I mentioned that, 15th of December 2021, I was diagnosed with perimyocarditis from one of the leading cardiologists in the country in Harley Street, because I had to go onto that stream to be able to access any sort of avenue of having proper tests, MRIs, and any formal results. From then, I have now been on a course of medication, and I'm slowly getting better. However, it is very clear in my conversations, which I'm having with this cardiologist and with leading professionals in the medical sector, that this is more than just a rare instance. It isn't just me, this is hundreds and hundreds of people. And like you all today, I'm shocked to hear the level of extent to how much this is occurring around the rest of Europe, USA,